We've got this fabulous guest who's been with us before. Dr. Justin Leaf is here with us. He is, I got to read this because it's so good. He's the co-director of research and director of training for the Autism Partnership Foundation. He is also a professor at Endicott College. I love Endicott, have been there. I spent a week there 2 years ago before the pandemic with my son. We just absolutely loved it. He has a doctorate degree in behavioral psychology from the Department of Applied Behavior Sciences at the University of Kansas. And he is a brilliant mind, I can tell you that much. And he's got over 100 publications in peer-reviewed journals and books. He also recently edited a book entitled Handbook of Social Skills and Autism Spectrum Disorder Assessment, Curricula, and Intervention. Sounds like a light read. And has co-authored 2 other books as well. So this true expert in the house this morning. And we are so thrilled to be talking with him. I did want to mention that he has several areas of expertise, but includes within those examining methods to improve social behaviors for children and adolescents with autism in the area of developing friendships, and comparing different methodologies, evaluating parameters of reinforcement, and evaluating long-term outcomes for individuals diagnosed with autism. So how amazing is it that we have him here with us? So Dr. Leaf, welcome back to Autism Live.
Hi, how are you doing?
I'm good. How are you doing?
I'm hanging in there. It's much better this week than last week. My wife had COVID, and so she's safe and healthy, and my kids can go with her again. So I'm so glad to be back on.
I'm so happy that she's doing well and that you're doing well and that the kids are doing well. Thank goodness for that. But
I have to say before you get to my questions, I just want to say I have all my doctoral students come and listen to you speak as part of the course about the jargon of the day or the jargon of the week, so that they learn how not to speak in jargon. And so
I love that.
I just want to let you know that every semester 16 doctoral students are coming to listen to you.
That's hilarious. I have to ask because one person came up to me a while ago and said that at their college, they were asked to watch the jargon of the day too. But the reinforcer for the students to do that was that they would take bets on how crazy my hair was. Because over the 10 years, I've had very crazy hair, and that was the thing that they enjoyed the most. Do your students take bets on my hair, Dr. Leaf?
I don't think they take bets on your hair, but I bet you they take bets on other things, is my guess.
Oh, okay. I guess I need to know what those things are. But I find it hilarious because we started Jargon of the Day so that we could understand you guys. And I think it's fun that now you guys have taken it as a way back for you to be able to speak to us. It all makes sense to me. I'm happy. But I'm really happy to have you on the show because we do talk about ABA here. And I think, Dr. Leaf, that I am a huge fan of good quality ABA done at the right intensity. I attribute all of my son's success to the fact that we had good ABA at the right intensity. So I make no bones about the fact that I am a huge fan of good ABA. But I think that it is imperative that parents and caregivers and teachers all have good training, and obviously for the people in the field to have good training about how to do good ABA. And you have something right now that is, we've been talking about it here. You have some training that's available online that I want you to share with the folks that are watching what it is and how they can access it.
Yeah, so about 2 years ago, February of 2020, right before the pandemic hit us, at least in the United States, we launched a free 40-hour RBT training, and you can get that at autismpartnershipfoundation.org, and there's a education or training link. You just click that, and you'll see that link and can access it. So it is free. It was always meant to be free. It was when we had the idea of creating it, we wanted to put out a resource really for young, inspiring behavior analysts that they can get training on passing the RBT task lists and getting their certification. What we didn't expect is obviously the pandemic. And when the pandemic hit, we realized really quickly, we're getting not just people who are interested as becoming RBTs, but we were getting parents. We were getting entire school districts coming to our training and getting it because they couldn't be in person and get training. And so what we thought we might get like 3,000, 4,000 people, we're at like 200,000 people have signed up in 2 years. And so I think the training, I think it's quality. I'm biased because I know I did the training, but I do think it is quality. And I know it's a resource for anyone who's interested about applied behavior analysis as it relates to individuals diagnosed with autism spectrum disorder. And so we're proud that this training is available, and it will continue to be available for free for the end of time.
And I'm proud of you guys because this is important, and this has always been important, but there is no time that we need this more. And the fact that you've made it free is absolutely incredible. Now, for those of you who don't watch the show on a regular basis and you're scratching your head going, RBT, I don't know what RBT is. I'm not even sure I know what ABA is. Let's back up the bus just a little bit and talk to us, Dr. Leaf, about what the RBT designation is and what it translates to.
Yeah, so the RBT is a certification under the BACB, the Behavior Analyst Certification Board, which is one of the leading certification boards in the world for applied behavior analysis. And the RBT was created, it stands for Registered Behavior Technician. It was created for direct line staff, those individuals, those professionals that come and work directly with the autistic child or the autistic adolescent, autistic adult. And so to get your RBT, you have to be 18 years of age, you have to have at least a high school diploma, you have to take 40 hours of training, which is what we're providing. You have to take a competency assessment, so actually showing that you can implement certain procedures to a degree of fidelity. And then you have to take a multiple choice exam. And if you pass all of that, then you can become an RBT. And that's important because it's a way to tell parents or school districts that you've met minimum standards and that you're qualified on these minimum standards. And so that's the RBT certification. Now,
and in fact, excuse me for just a second. For instance, if you have a child, and let's say that your insurance provider is TRICARE because you're military, and your child is getting ABA services, your insurance company, TRICARE, requires that your therapists have this certification. In order for them to pay for it, they say they've got to have that certification or we're not going to pay for the hours. So it becomes really important.
Yeah, it's absolutely critical for families and individuals to gain access to needed services, and so it's just absolutely critical. And insurance companies across the globe are requiring it, and so I think that's one reason to get it. I think the benefit of what we did, and the benefit of any RBT training, is that it's just not really meant for those who are wanting that credential or that certification, because the areas that are being trained upon could be beneficial for families, they could be beneficial for teachers, they can be beneficial for autistic adults who want to learn more. It's beneficial for everyone because the material is important for everyone.
Yeah, but I think one of the things that you guys did is, first of all, by putting it online, you made it accessible to a whole bunch of people who couldn't get to a college classroom or to, a county building to sit for 40 hours because where was their child when that was happening? So putting it online gave some accessibility, but then also making it free, you sort of leveled the playing field and said, we're not going to hold it against you if you can't afford to pay X numbers of dollars. So I applaud you for having done the right thing. I'm sure that it costs you because this is not, these things are not free. So I want to talk about that in a second. But what else should, because it's not the only RBT training that's out there, but what is significant besides those two really important things? What's different about your program?
Yeah, I think what is different about our program is we endorse, not to get too jargony, we endorse something called progressive ABA. And I also want to say, not to get political, because people have gone on this political rant that I'm progressive and I'm taking a side politically. What we mean by progressive ABA is exactly what you were talking about when you were talking about STEM. It's that we're not taking a cookbook approach. We're not just saying, you go into this program and these are what we're doing. You're going to target STEM no matter what. You're going to teach this no matter what. This is how you teach it. We work on flexibility. So you have to be flexible based upon your learner. We work on clinical judgment. So staff and parents have to use judgment of what to do or what not to do based upon how the child's doing today or based upon what's going on in the child or adolescent or adult's environment. And so I think what's really different about our training compared to the other trainings that I've seen or have heard of is that we're really helping train on this flexible, compassionate, kind, clinical judgment approach, and how that you can do that on all aspects as it's related to behavioral intervention, whether that's being on a certain intervention procedure or working with parents or working with schools or what you're actually teaching. So I think that is the big difference to me, is that we're really training upon that.
If you were here and it weren't COVID, I would hug you. Because this is what we need, is that, we need to be talking about these kinds of things, but we need to be training people in these things. So I absolutely love this and I commend you. But I'm told that this is not the only kind of training. This RBT training is not the only training that you have for the community. Can you enlighten us? What else do you have?
Yeah, so we also created in April of 2021 an 8-hour supervision course. And like the RBT course, it's a free course. So we have 5,000 people that signed up to that, and we haven't marketed much in this year, in the last year. But it's for those who are board certified behavior analysts. Those are the supervisors of those RBTs, the ones who help with the programming, the ones that help work with parents, work with schools, help with curriculum. We have created an 8-hour course because they need to take 8 hours of didactic instruction to learn how to become a supervisor. And so one of my colleagues, Dr. Christine Milne, is the one that did that. And it's a great course to learn how to be a good supervisor, once again, on using clinical flexibility and compassion and all that stuff that's needed so that you can provide the best supervision to your staff. You can provide the best supervision to the learners you are fortunate enough to work with, and you can work collaboratively with parents and school districts. And so we decided early on that we wanted to provide these resources for free to our community as a way to, I guess, give back, as a way to help those who, as you say, can't afford it or don't have the time to take these at a university or a straight 40-hour day.
Yeah, I mean, especially when you're having to make choices, and saying, okay, do I pay for this special diet? Do I pay for the tutor for this? Do I pay for this? Learning the kinds of things that you're talking about, we never want to be the thing that is the third on the list. So you've taken away some of the obstacles. Like I said, I'm so thrilled. So again, anyone can take these courses. They don't have to quantify or qualify. They can take them. They can sign up to do them. I know Traven put it in the comments where you guys need to go, but autism-partnership.org. Is that correct?
autism-partnership-foundation.org.
Foundation, autism-partnership-foundation.org, to take either of those courses. Now, obviously, if you want to go on to get that RBT, then there's other things that you have to do besides the course. But if you're a caregiver, if you're a parent and you're like, I just don't know these things. I always had a sign in our kitchen that said, Jem's program is only as strong as the weakest person on the team, and that will not be me. That was my mantra as a mother. That he's got a team of people and it's only as strong as the weakest person on the team, and that will not be me, which meant that I needed to get more training than the people that were working with him. If you're on that page as a parent or as a teacher or as an aunt or an uncle, and you're like, Shannon, that resonates with me, then you would want to do this 40-hour training. And you will learn from it. You'll go, holy business. I didn't realize that makes so much more sense. So I really encourage people to do this, and it's free and you can take it on your own time. But talk to us a little bit about what you have seen as a result of people taking that course, Dr. Leaf.
Yeah, I've seen, and it's hard to see anything because of COVID and I've been locked down. But from what I've seen from emails, I've seen people's lives change for the better. I'll tell a story of one person recently emailed us that they lost their job because of COVID. They were homeless. They were going to the public library to go take this course, and they took the course. They got their RBT certification, and now they get to go and they found a new job, a new career where they're helping children become the best versions of themselves. And so that was for me eye opening. I'm seeing more people doing towards a clinical model and towards a clinical judgment model where they're not just doing this cookbook recipe like the books behind me, where they're just following it to a T, but where they're actually now thinking about what they should do, what's the best choice they can make in the moment. As I started off about saying doctoral students, I have doctoral people who are interviewing to become doctoral students saying, we took the RBT, we love this, we're starting to implement this, we're starting to implement this. We think about curriculum differently now. We think about why we should teach things versus just teaching it. So for me, I'm seeing a change in I'm seeing a change in how people are implementing or thinking about ABA. The other thing I saw is that more people are probably sending them to this training, and I think that's a good thing. I want people to come to this training because I want people to be quality therapists or understand what quality ABA is all about.
Amen to that. We've been sending people for the last couple of months. We've been pushing people, but I didn't know about the supervisor training. Now I'm going to push people to the supervisor training. Some of the questions that we have coming in, Alvatina wants to know where to find the course again. Again, you want to go to autismpartnershipfoundation.org. And then there are tabs that you will look for courses. And for this particular one, you'll look for the RBT course, Alvatina. But we have several people asking, is this a course that someone who is a self-advocate might be interested in? And I can't think of a reason why it wouldn't be a good thing. I think if we could get self-advocates who have concerns about ABA to learn more about what the principles of ABA are, that we would be having a much different conversation. Dr. Leaf, I'm fond of saying now to people, ABA is a teaching technique. I understand that makes some of you experts break out into hives because it's so much more than that. But for me, on a very basic, no jargon level, it's a teaching technique. It's a series of tools that we know are effective, that science has proven are effective. And just like, when you send your child to fourth grade, there are some fourth grade teachers who are amazing and know things that other teachers don't know. So, I know that there are people who have had negative experience with an ABA provider. I would argue that is not all of ABA. I'm asking people to take another look, and how better to take a look than to understand what the thing actually is.
Yeah, Shannon, I can't agree with you more. I think it's meant for everybody. If you're part of this autism community, which is autistic individuals, parents, grandparents, caregivers, siblings, therapists, teachers, and you just expand that community out, this is good for you. I think this is helpful. I think the other aspect that I like about it is we have a lot of videos. I mean, it is boring to hear me talk probably for 40 hours or my colleagues. Like I agree. But the videos, I think, really highlight what we're talking about. They're videos that show exactly when we're talking about a procedure and you see the video of it. I think it resonates to the audience members. Oh, this is how we can implement it. I think that people see differences how they typically are implemented versus how we're implementing it in our training. So I encourage everybody. And I guess the last thing with that is, of course, there's going to be modules because it's like 16 modules. There'll be modules that some people, parents or self-advocates, won't care about, like the jargon. There's a whole jargon one, which you need to know to pass your exam. That's not probably the most exciting, but maybe social skills groups is something you like, or maybe curriculum is something you like, or working in schools might be something important. So I think there's something for everybody in this training.
There you go. Julio has a great question. He wants to know, what happens if you don't have autism? Are other disabilities able to attend? Great question.
Shannon, I think it brings back to your point that the ABA, the teaching techniques are universal. When I used to go and present at school districts, I had to show clips of Mr. Holland's Opus and The Karate Kid and Borat, for example, and show how teaching can help anybody. So I think, yes, it's definitely more autism specific in terms of the curriculum and stuff, but the procedures would be good for anybody who's interested in applied behavior analysis.
Yeah, and I think I think ABA needs a new PR agent.
Yeah.
Because I think there's a lot of misinformation out there and a lot of misunderstanding that there are many people who think that ABA is just for autism, which is when I remember when somebody said to me, oh no, the field of ABA, more than 50% of it has nothing to do with autism, that it's for corporations and, that they use ABA techniques with Olympic athletes. We were to go through and see all these people that are about to compete this month in the Olympics. If we were to go through and go, what techniques does your trainer use to get the peak performance out of you? I think we would find across the board, it's ABA, ABA, ABA. So this isn't just used for autism. It just happens to be very effective in autism. So that's the good news. But, as a former teacher, I think when you find teachers who understand the principles of ABA, you find good teachers. So who can teach anyone, which is amazing. I love Amanda says that this is the #1 link shared in all of her ABA groups. So look at all the inroads that you're making there. So again, if you are interested in finding out more information about this, what you need to do is go to autismpartnershipfoundation.org. There's other things on the website for people to look at. I encourage you to take a tour around the website, but there's a place where you can go for courses, and one of them is that RBT. RBT stands for Registered Behavior Technician. Now, I'm going to put you on the spot here a little bit, Dr. Leaf, but you guys usually do a conference as well. In COVID, I know that things have been a little bit different. Are you guys doing a conference this April?
We are doing, now this is where you put me on the spot, so I don't have the date in my head. It's the first Friday of April that we're doing, like 7th or 8th or something like that. And we're having a variety of people come on. We're having Bobby Newman to talk about sexuality in adults with autism. We're having Linda LeBlanc talking about organizations. We're having Taylor coming in to talk about his own experience of being an autistic adult, and a bunch of others as well coming in to speak. And it's all virtual because we were worried about, COVID and what was going to happen, and we didn't want to put anyone in danger or in harm. So if you go around the Autism Partnership Foundation site and you play around, you'll see a link for that as well.
Wonderful. It is on the 8th and the 9th.
Yep.
We have confirmation about that. So be looking for that, you guys, so that is something that you can attend as well. And I just really want to thank you for the work that you're doing, Dr. Leaf. I think it's super important. I think you've really filled a need in a time when we always needed it.
Yeah.
And even when COVID is done, we're still going to need it. But you made sure that this happened in a time when we desperately needed it.
Thank you. Yeah, it's one of the great honors that we've done. I think it's the thing we've had the most impact on. It's just not me. I want to say it's also my colleagues, Joe Sheehan, Christine Milne, and Julia Ferguson. We all came together and worked for 2 weeks tirelessly to make a 40-hour video or series of videos.
Series.
So yeah, it's great, and I'm glad people are getting access to it.
Well, remarkable. But I'm sure that it's not easy to have done that and to be doing it so that it's for free, because you could monetize it and you could say, I'm going to charge everybody $10, and that would be no small thing. You've already said you've got thousands of people using it. So is there a way that we can support your organization for having done that for free? Is there a place where people can donate? What's the deal?
Yeah. First of all, don't feel the need to donate. We understand if people can't, but if you can donate, it's autism on the same link. There's a donate button. You just donate. I think it goes through like classy.org, and you donate whatever you want. It supports this training. It supports other 8-hour trainings that we gave. It'll support future trainings that we try to get for free. but it's absolutely, we're not expecting it. If you donate somewhere, we would be very thankful to do it because it helps on all our endeavors.
But it's necessary, and I appreciate you saying that. But it doesn't harm it to put it out there, because it is not easy to put things out that are free in this way. So we commend you, and we're so glad that you're on our team and fighting hard to do what's right.
Yeah.
I just lost an earbud. There we go. I'm trying to make the earbuds work, and it doesn't. It's not great for me. I lose one by the end of the show. But Dr. Leaf, thank you so much. Please give all our love to everyone there, and we'll look forward to hearing more about the conference as it gets closer.
Well, thank you for having me, and thank you for promoting this training. I think it will help the autism community in great ways, or continue to help in great ways.
Well, we're always about connecting people to resources here. And, we frequently, it's one of those things where something will happen, somebody will send in a question, and one of the many experts that we have on the show will start to give an explanation, and you could hear or see the light go off in the caregiver's head. They're like, oh my gosh, you mean, how you have techniques to be able to deal with tantrums? I wish that all of you understood that for us as parents, that's news to us. The first time that I had a conversation with an expert who was like, oh yeah, the potty training thing, we've cracked the code on that. We pretty much, it takes a little bit different, and it's not a one size fits all, but we can pretty much potty train everyone without it being disruptive or hysterical, or, it's pretty doable. I remember feeling like, what? Like, why wasn't that on the news? Like, why didn't they announce that you guys have answers for certain behavioral things that are not hard and that help our kids to be able to be who they want to be? And so to be able to have access to some of that information, I certainly felt closed out of it when my son was first diagnosed. I was like, where do I go? Who can teach me this? Teach me everything you know. And the fact that it's available and somebody could access it in 2:00 in the morning if they wanted to, it's a really special, Dr. Leaf. I really applaud you. I'm so grateful that we can refer people and tell them to go do it. And the fact that it's free makes it so much easier. Takes the roadblock out.
Well,
so amen. Keep on plugging on. Stay safe. I'm glad your wife is feeling better. Everybody stay healthy.
Thank you, Shannon. And thank you for having me. And if anyone needs to contact me, you can see it through autismpartnershipfoundation.org, my contact information as well.
All right. Will you promise to come back on sometime, and we'll talk, we'll still talk about this, but we'll talk about other things in addition to this?
Shannon, you invite me, and I will always come on whenever you would like.
All right. Well, I'll be calling you. All right. You have a lovely day.
You as well.
Bye-bye.
Bye.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.